going to ride in a box, end up in the ocean, land on a beach, and then we'll make it to the symposium.
Will we, though?
Do I believe in holistic medicine for flea prevention? No.
What are you talking about?
Because there is no accountability and there's no rules, students are getting taken advantage of.
I don't want to see students coddled so much that they cannot handle reality.
You'll get punched in the face with the real world.
Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Really remember to write us a review. What?
What do we do?
Deja vu?
Yeah, what?
Deja vu?
Deja vu.
Deja
Yeah,
vu.
exactly.
Okay, well, on Spotify, we were at 3:30, and now we're at 3:31.
Womp womp.
And on Apple, we were at 1:29, and now we're at 1:30.
Oh, darn, we didn't move.
Moving on up.
Goodness.
They're staying right there.
We did not move. That's okay.
Promote us on our social.
No.
Follow us on socials, Instagram and TikTok at the Veterinary Roundtable. Then go to our YouTube channel at the same time and type in the Veterinary Roundtable where you can see our podcast.
If you
Here
don't
we
want to
go.
just listen, you can watch us.
That's right.
Sometimes it's fun to watch us.
Hey, you know what's going to happen soon, though?
We're moving.
From?
Friday. So we publish on Fridays right now, but we're going to be posting on Tuesdays instead. Same
Yep.
time, 9 a.m. Eastern
Podcast.
Standard Time.
Yep.
But you get to start the week with us instead of end the week.
That's right.
There we go.
Or
Pretty awesome.
you wait till Friday to listen.
Yes.
It's up
If
to
you really like Fridays, you are more than welcome till week.
Yep.
And start your weekend with us.
Okay, this is like one of my favorite episodes, though, guys, because it's the mailbag episode.
Oh, yeah.
Oh, yeah. This is a really fun one. So
And
it's like
I
rapid
love
fire
this.
questions.
Yes, it's just rapid fire questions, and I
Yeah.
just enjoy all the
We
questions.
love answering
It's
questions.
It's all
a
different
good
topics.
variety, too.
So it's really fun.
Yes.
I love
Yes.
it.
Pick our brains.
Yeah.
We get to dibble dabble and everything.
I'm Dr. Ashlyn Duckwall.
I'm Courtney Allen.
I'm Dr. Emily King, and this is the Veterinary Roundtable.
Welcome.
The Vert. The
Welcome.
ladies in red.
Okay, pits and peaks, peeps.
Oh dear. I know. I was like, oh crap. We gotta remember more. Do you guys have it?
Oh, dear.
I did.
Um,
I did this morning when I was walking, and now I'm trying to
This
remember.
way you have to write things down
what it-
because I do
know,
the same
Courtney,
thing.
I know.
I'll go.
Okay.
Oh, well, I don't actually know though.
Okay. So my peak is that I got to go to Tennessee for 4 days,
Okay, yeah.
and it was amazing.
That's nice.
My pit was that I had to leave Tennessee because it was like 70 degrees.
Yeah, I don't blame you. I'm sure it's lovely.
And it was amazing, and I got to be outside,
Yeah.
and it's like such a great place to be outside.
You don't get to complain. At least you got to go.
I get to go. That's right. I won't complain. All right.
Yeah.
I'm just kidding.
King.
Kind of.
Yeah,
Not
and my
really.
dog loves being there. She's like, it is like her, like, it was hilarious. We got in the car to come back, and she was like, mm-mm.
Pouting.
She turned around and went the other direction, and she looked around. I was like, no, you like literally you have to come. And she was like,
She's like, I'll hold down the fort here. You guys go. I'll see you in
Yeah.
a
I'll
few
see you
weeks.
later.
She's so good at her job there. It's so
Oh.
fun to watch.
Yeah.
It's so amazing. And
Yeah.
she's so good. Like, she'll be in the front. She patrols the whole area. And then she'll be in the front and I'll be in the back. And she'll bark. And she doesn't charge anybody, but she barks to
Yeah.
say somebody's on the property or near the property. And then I'll be like, Kaya, and whistle. And she comes right to me.
Oh,
Even though she's distracted by
Yeah.
something else.
She is
Unbelievable.
Winnie
did you do
reincarnated.
I'm
telling
like
you.
official training, or you just
No,
been working
it's
with
just
her?
her instinctual.
Oh.
No, I have nothing to do with this.
She said after Winnie she's done training.
Holden
Yeah.
did a lot of work with her, but some of this stuff is just instinctual.
Yeah.
You know, Calvin was writing, he created, because it's like bike ramps. Oh, God. I just can't tell you. I wanted to stab my eyes out. Okay. So, like, every day it was something. It was like one-upping the bike ramp.
Yeah.
So Kaya loved to chase him. Like, he would jump and then she would take off. Well, he was getting nervous because she's fast.
Yeah.
Like, fast. And so we were outside and she was so good. I was like, Kaya, come. And then I would get her and I'd target on my hand, and then she would sit next to me and I'd be like, stay. And then he would jump and then I'd be like, go get him. and then she would go get him. And so then I do this with her with the deer because I don't like the deer on my property because they eat all my vegetation.
Yeah.
Sorry, my pit and peak is lasting forever. Anyway, and so they eat all my awesome vegetation. And so we'll be sitting out in the morning on the porch and deer will come traipsing around. And I'm like, Kaya, do you see him? And she's like, she looks at him and I'm like, go get him, girl. And she goes, she like goes get him. She's like, rah, rah, rah. She doesn't get very close. But
Right.
I mean, then they move on their way.
Oh, that's so cute.
If you
I
don't know
love
who
it.
Kaya is, she's a Doberman,
She's
and
a
she is
Doberman.
gorgeous.
Yeah,
and she's
so
amazing.
cute.
She's
Oh my
amazing
God.
at her job. I tell her that every
She's
day.
an angel dog.
Here she tries to do the job, but it doesn't work very well.
Yeah.
So
Yeah.
it's not the same. Anyway, okay.
Wow, that was a good one.
Okay.
Okay, I can go. I don't think I'm going to top it, but whatever. I'll start with my peak. If you don't follow us on Instagram, you should for this exact reason. I don't know if either of you saw or if you saw me add it to the album. I have baby birds. I'm a mom. I'm just kidding.
I saw that.
So I have a wreath on my front door, and it's just like made out of like sticks and fake leaves. And I noticed that like every day I would come home and like there's just like pieces on my like front mat. And I was like, okay, it's going bad. I'll just go buy a new one. Well, we got home the other day after being out with my family, and I told Jacob, I'm like, we should check it because we started noticing there was been a nest that has been built.
Yeah.
And every day we get home, birds are flying away from our front door. And I'm like, okay, they're building a nest, whatever, it's cute. Well, I was like, we should look and see if there's eggs. There's 4 little eggs.
Oh
So
my
there's no
gosh.
way to like, I can't look in the nest when the mom's in there because like
Yeah.
our peephole, it's above the peephole, but then there's nowhere because like my upstairs looks down, but then there's like a roof over our front
Yeah.
door. So I can't see. But at night, like the other night, we were sitting on the couch and I paused the TV because you can just hear all the little noises because they're bumped up right against the door where their nest is. Like their nest is literally flat and then it's like the nest like around it because they built it like on the door. So it's literally just like a flat back like nest.
Yeah.
Oh my
But you can
gosh.
hear them out there like bringing stuff and we
Aw.
just see like every time we get home, we touch the door, the mom flies away. But then she comes back. We're not touching it. I touched the bottom of the wreath, but I didn't
Yeah.
touch the nest. But it's just cool. So
Isn't that
but-
interesting? They can nest anywhere.
I know.
I know.
yeah, when I
fascinating.
started figuring, I
That
was
wreath
like,
is not
oh,
that like thick either.
No, it's very thin. But now I have to be, which I'm trying really hard to learn, because if I slam my door, I'm going to get those baby birth concussions. Like,
Yeah.
Once they hatch, if they do hatch, I'm going to have to be really careful, which is
Yeah.
going to be hard to retrain myself because I just walk in and I slam the door. Like, not hard. I mean, I just close the door like normal. So I'm going to have to be really careful because if
Yeah.
I close the door and I come back out and there's a baby bird laying on the ground because
Oh my gosh.
No,
Or if it's like
You're gonna
really
die.
windy,
yeah.
like I don't
Yeah.
know. I don't
You
know
need
how
a
much
bird
wind
cam.
catches
You
right
need one of
there.
those bird cams.
I know.
Yeah.
That's what I told Jacob. I said, can we please buy a camera and put it out there so I can watch them? So maybe that'll be my weekend project.
It's like the eagles that had the chicks.
Yeah.
That they have a camera. Same thing,
Yeah.
just smaller
Yeah.
scale.
So I think I'm going to go buy a camera.
There you
Yep.
go.
But my pit is, I'm not sleeping good.
Okay. That actually
Sleep
sucks.
is hard.
Yeah. Sleep is hard.
I've never had problems sleeping though, ever in my life. I'm a super hard sleeper and all of a sudden I'm a really light sleeper. Miles was literally dreaming last night. Like in his sleep, he was barking and I woke up. Like barely barking, just like the boop, boop, boop.
It's
I
the
woke
worst.
up.
Do you have a hard time going back to sleep?
Yes.
That's what bothers me about
Oh.
waking up.
Well, it
Yeah.
depends, but
is
most
having
of the time,
difficulty
yes.
going back to sleep.
Because
Yeah.
Jacob will be snoring.
Oh.
And then I'll start crying because I get
Cannot
really
deal with the
frustrated.
snore.
in our
'Cause
guest
you know,
bed-
right? You know that the your alarm's going to be going. You know what I
Yeah.
mean? It's like you're fighting
Mhm.
this battle between I need to fall asleep now.
Or
I
waking
hate-
up 30 minutes before
Yes.
your alarm goes off.
That's what
Yeah.
I was going to
If
say.
I wake up at like midnight, I'm so happy. If I look at my
Yes.
phone, I see it's midnight. I'm like, oh my God, I have so much more time to go back to sleep. If I wake up at like 3:30 or 4, I'm like,
Yeah. I
like,
know.
is there any point
It was
of
really
trying?
sad.
And that's when you do get into a deep sleep
I
and the
know.
alarm goes off.
I
Yep.
know.
Oh, gosh.
It's going to happen to us tonight now.
fine.
My pit is that my horse has a corneal ulcer. That
Oh.
sucks because horses with corneal ulcers, if they get bad, they get real bad. But I think I caught it pretty early because Saturday I went out to take care of him and he was winking at me.
You're
I was like, "Ugh, what the heck? And Charles was like, how does that happen? I was like, they're horses. They do whatever they want and it
Yeah.
happens.
they literally eat hay.
Yeah.
Hay is sharp.
and they
Eat sharp
get a
items.
piece of hay in their eyeball. So I had some ofloxacin eye drops at home, but they're expired. So then I had to go to the clinic on the weekend and get some eye drops. But then it's only twice a day. I just think of all the horses that came to Purdue. Oh my gosh. And they were terrible ulcers. And it would be like every 4 hours you put eye meds in. And they had to get a lavage. I was going to say,
they have those. Yeah,
yes, because their eyelids are strong.
So strong. Yeah.
But thankfully, after even just doing a couple days, twice a day, he's opened his eye back up. It looks clear. I didn't stain it, but I could see the little spot. So we're going to do it for a week. Just kind of cover our bases.
Poor guy.
Yeah. It sucks when your animals are sick. Arthur.
Okay.
Yeah.
I figured it was him, but
yeah. Even though Jazz has the big eyeballs.
Right.
Ow. And then my peak is that we planted some flowers, which have been long overdue in like our flower bed going around our house. Helen helped. It was the cutest thing.
Aww.
I got her like a plastic spoon to dig up the dirt. She did not much. But we planted like wildflowers. So hopefully it's really pretty and just abundant over there. But we get a lot of bunnies. So hopefully they don't eat too much.
They will.
Yeah. Hopefully not all of them.
They will. Like, this is amazing.
They will. Yeah. Especially where you live. They will.
Yeah, I know.
Because my mom's flowers don't last long.
Oh,
my parents have done so many different things. They've gotten fences.
Yeah.
We've gotten coyote pee. You put your hair from your hairbrush on. I mean, they've done everything. They have bottles of coyote pee in their barn. Like, or in their shed.
Oh, my gosh.
Well, I'll just send Phyllis out because she'll get them.
Oh, goodness.
Phyllis the hunter.
Phyllis the hunter. Okay. Our next segment, Tales from the Trenches. This is still a new segment where we want listeners to send in their most ridiculous, funny, unhinged stories that we can read on the podcast. You can send your stories to the Veterinary Roundtable at gmail.com. Just so you guys know, we do not read these ahead of time. So we are reading them in real time and listening to it for the first time with you all. So
yes.
Ooh, this is
we never know. We always get worried.
I know
what we're going to read. Okay. Hi again. This is Dare from NC, a veterinary assistant. I wanted to give you a tale from the trenches that always makes everyone giggle. We had a cat come in due to dental floss hanging out of its mouth that we thought had partially swallowed. We pulled the cat out of the carrier to examine, and to our surprise, there was also floss sticking out of the other end of the rectum. We thought surely the cat had chewed and ate several different pieces, but to my secret delight, when we did the foreign body surgery, the dental floss was one complete piece and traveled from the mouth all the way through the systems and out the other side. Cat recovered fine, no damage to internal organs. It was definitely a fun one, but everyone present had to use a lot of willpower because we just wanted to pull the floss. Haha. Love the podcast and especially love the Tales from the Trenches because I love hearing the wild and funny things that go on in the veterinary field. Dare.
Thank you.
That has definitely happened to us.
That has definitely happened to us.
We just had one a few months ago, actually.
Really?
Yeah. Was it a cat or was it a dog?
It was a dog.
Yeah, that's what I was going to say. I thought it was a dog. But yeah, that is crazy when that happens. But she is exactly right. You have to channel your inner patience because you do just want to tug on it.
But then the intestines will go.
I know.
Yeah.
Bunch all up.
Yeah.
That would be bad.
Yeah.
That's a good question. Somebody might say, why don't you just pull on it?
Well, yeah, it could be anchored somewhere. So if you can imagine pulling on a tube that has an anchor and then it literally like an accordion.
Yeah. Slice through it too. Dental floss is really sharp.
Yeah. Yep.
Like when you pull it taut, it slices stuff.
Plus, you don't know how long. I mean, you'll get the history, but if it's been there a while and you already have compromised the gut, it's very friable.
I wonder if this one had floss stuck around his tongue. Did she say that?
No.
It said out of the mouth and the other end.
It didn't say anything about the tongue.
Very
Cats like to get things on their tongue.
Oh, they ever.
Because their tongue's like sandpaper. It's like a lint roller.
Gosh, I know.
And they just like to eat stupid stuff like string.
Especially string. String is a fun one. Which, why? I don't know. Like our clinic cat, he's obsessed with balloon strings.
Yeah, I don't know why.
Like they just sit there and they're like, it just keeps going down.
That's what Walter would do. He would just and he was hanging out and you're like, Walter!
And they just keep like doing the tongue thing and then that's how it keeps going farther down.
Yeah. I wonder if they as a cat society like go, hey, this is the way you get attention.
Yes.
Eat stupid stuff.
Dumb ways to die.
Dumb ways to die.
This is one of them.
That's what we got to remember that could be a great one for the board.
Oh yeah.
5 dumb ways to die as a cat.
Be a male cat.
Right.
Yeah,
You can't be.
Be an orange male cat.
Be an anxious male cat.
Yeah,
Yeah.
right.
Oh, gosh.
Okay, on to listener inquiries. The way you can actually send these in is our text message feature for our podcast. So you'll tap on the episode in your podcast provider of choice. You look at the top, it will say send us an inquiry through a text message here. All you do is got to click that and you can type whatever you'd like. If you do want to shout out on the podcast, you do have to include your name. Otherwise, it comes through as anonymous.
Bada boom, bada bang.
Okay, first one. Here the mailbag
The
is starting.
mailbag.
Let's get ready. Here we
It
go.
makes me think of Blue's Clues. Mail time.
That's right.
Okay, so first one, number 1. My name is Kim and I am an assistant. I am listening to the mailbag episode, look at that, while walking one of my 3 Samoyeds. They are the best. I think they're underrated, so I had to stop mid-walk so I don't forget to send this message. Once again from Kim. We had a Samoyed day. We had 2 come in today.
Yeah.
Oh, that's
Ironically,
really
I saw that picture in our group clinic text.
We don't see a ton of them.
We had a
Yeah.
10-month-old and then an older one.
Oh,
Yeah, so they were
they're
different
kind of
sides, but
underrated.
I think they're so
do
cute.
enjoy them. I think
Yeah.
they're spunky, but like not as spunky vocal as your husky.
Yes,
Malamutes
they're
and
like
stuff.
a lab version of a
yeah.
husky.
Yeah.
It's funny that you say that because the older one that came in today, she came into the building. She came through the lobby at 7:15 a.m. And I don't know if you would know, but you know Miles' Chewbacca noises when he gets excited.
Yes.
He just
Yeah.
sits around and goes, ooh. That dog walked in the clinic, go, ooh. The second she walked in and did not stop.
Yeah.
And she cried all day and howled all day. So it's funny that you say that.
Oh, that's cute.
Oopsie.
Oh, well.
It's definitely a dog breed that like I feel like when a family gets attached to it, they have multiple of them.
Yes.
Usually.
You're not just one
Yeah.
and done.
And it's usually like they had experience of having it, not like, oh, I just picked this random breed. Because some people will come in and be like, have you owned this breed before? And they're like, no. Like not Samoyeds in general, but like,
Yeah.
Yeah.
So, I don't know. Very interesting.
Mm-hmm. They're cute though.
They are cute.
Oh, they're so cute. But they're a lot of maintenance.
Yeah.
A lot of hair.
That's a lot of hair.
of hair.
Okay, question number 2. In response to your podcast about study duty hours, this was recently brought up at a student lunch meeting with our dean. She was very quick to respond that the SAVMA suggested hours are actually just guidelines, and the school is under no obligation to follow them. She played the ignorance card and said that most clinicians are not aware of the time the students are there, and that we are responsible for keeping track as students and addressing this with the clinician in charge of the rotation. As previously asked, how should we go about making a change when we are in danger of retaliation via grades or poor treatment? How can we make this change in schools to better the environment of students? Note, a local news agency just wrote an article concerning the situation, and it was met with hate from administration and clinicians acting that they are unaware that students are being exploited. At em.m.coaster.
Yikes.
Talk about gaslighting. Isn't that what that means? I always have to confirm that's what gaslighting means, right?
That is hilarious. Okay. Gosh, this is so hard.
That is so frustrating. That just makes my blood boil.
I do see where the clinicians would have no idea.
But that's just then someone's gonna have responsibility.
No, I
other
understand. I mean, like I agree, but I mean, I can totally see that point.
I agree
that
there.
clinicians would have no idea. They don't even know some of the students' names.
No,
Probably.
you're right.
There's
I see
no
that.
way that they know how long those people have been there.
It's still enraging though.
So there has to be a system. So
Mhm.
like with complexity,
Someone's got to take accountability.
Well, you would think the higher ups need to be
yeah.
a little
well,
bit
I
more
think
aware.
you can get rigidity. So you could have time. You could have clock ins and clock
Right.
outs, and you could have, like
Just make a freaking chart on a piece of paper.
But that rigidity then creates additional problems. So now you're going
For
to
who?
be
For the clinicians.
well, not necessarily. No, but for
Because
the students
are
too.
there for free.
No, but the students. Then what if you have to be there at least 10 hours? But yet your work is done. Now you're obligated to be there. So I could see like where the rigidity would be helpful because you would then not be taken advantage of. But then also you could lose from the standpoint of being required to be doing something that you don't necessarily need to do. There's got to be a system that walks the balance between the two.
Can clinicians just be in charge of a group? Would they?
I don't think that it would work very well because
I don't think because clinicians rotate. It has to go someone that's.
I don't know how it works.
Like maybe there's an overseer of fourth years in general, and they're responsible.
But the fourth years are going to have to clock in and out.
Right.
Yeah.
I would rather have that. I'm sometimes waiting anyway. Like to your point of waiting around when you're done, we had to do that anyways. Like on ortho surgery, if there was a surgery going on, you were sitting your butt around waiting until that surgery was done, even if it went late, so everybody could round together at the end.
Oh.
So you're already waiting. You're already wasting time.
What is the number of hours that you would consider excessive?
Well, I think I would look at it depending on the block, because I do understand, obviously, if you're going to ER block and you're doing night shift, you're going to be there the wee hours, okay?
Right.
But I think practically, if you're treating them like how it will be in the real world, it should be a 10-hour workday or an 8-hour workday, depending on which block you're doing. Now, I can see how... So similar to in the real world, I would sometimes have to show up to work early to get paperwork done or to catch up if I was out of the office.
Mm-hmm.
That's where that then ownership would come in for the student and be like, okay, I have to take care of these patients by this time before my day starts. So then take that into account, I guess, maybe. But then it still goes back to, well, what's the expectation of that student to take care of how many patients at once? And I don't know. I think the problem is there really is no limitations. They'll just say... however many patients you get on the block, that's on you. So, but then you want to learn more, but then it's also like, you don't know how to stick up for yourself in that setting whatsoever. You're there because you're trying to learn everything. So you're going to feel everyone's personality is going to make you feel like you need to be there all hours of the night.
Right.
You don't really realize how damaging it is until you're at the end of the day and you're like, oh shoot, I get 3 hours of sleep and then have to go back and do it again.
Right.
I don't know. I just think because there is no accountability and there's no rules, students are getting taken advantage of.
Yeah.
I still feel like that. And I'm 6 years out. I still look back and I'm like, that time was awful. There are some blocks that were better than normal.
Yeah, that's what I was going to say is like, we just knew that like this block was going to be horrible. And then we just did that block and we were like, that was horrible. And then we moved on to like a better block, like optho. You're like, we're out of here at 5, peace. You know, and then you would do neuro and you'd be there until 10 p.m.
Right.
But it was never felt like, I never once thought that somebody was taking advantage of me. I guess it didn't feel like that. Maybe the way they spoke to us, maybe the way that, you know, maybe we didn't have like a really high patient like load. So then it didn't feel like that. Like, so then we actually spent more time there because that was our choice, because then, like, you know what I mean? Like being versus being made to stay there. You know what I mean? Like, so maybe there was like just differences and maybe it's schools. Yeah. Like some schools are more better at controlling that than other schools.
Yeah.
I never felt like we were overworked only because there weren't enough cases to go around. Like it never felt like, because you're sharing with an intern, you're sharing with the resident, you're sharing with it was like,
I think it was just more of like the minuscule, not minuscule, that's not the right word, the extra work. Like you were doing just the work that
like a kennel attendant would be doing.
Yes. Yeah. Like, I don't know. I'm just thinking like sitting and watching.
Now, see, that was the difference. We didn't do that work.
Yeah.
Like we had technicians that worked in our departments because we did not have technicians in our school.
Yeah.
Like there was not a school for technicians. Mm-hmm. So there weren't also then technicians there.
So we still had tech students and we were still doing all of like the morning treatments, the cleaning up the kennels, the cleaning up the stalls, the sitting and watching and charting something every 2 minutes in a plasma transfusion, like things like that.
Oh yeah, we did that kind of stuff.
Yeah.
But
I mean, that's what I am looking at.
Yeah.
I mean, there were blocks where we knew it was going to suck.
Yeah.
Like, it was going to be long hours. It was going to be crazy depending on what was coming in, what was coming out. I don't know. Maybe it was just the way they talked to us then.
That's what I'm wondering.
Maybe that's what it comes down to, the way they perceived the students and how they didn't give us the respect to have conversations we would want to be a part of.
I think that's what it is. Big part of it, because if you're around people that inspire you or that you want to spend time with, then it doesn't feel like, and there were definitely rotations where you're like, this person's an asshole.
Right. And maybe looking back, like those are the ones that were the frustrating ones because they're not only busy, like really busy
Right.
blocks, ones that you knew were going to be hard, large animal medicine, small animal medicine, whatever. But it was also probably because then the interns or residents and the clinicians were stressed because it was already a busy block. So then we get kind of left to, the students would get left at the back burner, which then made us feel like we were just free labor.
Right.
Maybe. I don't know.
Yeah.
I don't know.
Well, I mean, if that's the way they're feeling, it needs to change because
Right. And maybe that's not the majority. Maybe it's a small percentage of the class. I don't know. I would love to know. I would love to take a poll from my classmates and know and see how they felt through the process.
yeah.
Mhm.
Like maybe it comes down to different personalities
Well,
too.
yes,
I don't
and
know.
I think the rotations. I bet you anything
Mm-hmm.
that if they rated rotations,
Right.
like it would always be, like at the school, like you
Mhm.
had to do ratings of like
Yeah.
where you felt like abused, like from the standpoint of workload and whatnot.
Sure. Yeah.
I bet you anything it'd be the same rotations over
Yeah.
and over again.
Probably.
And I bet then if they looked at the systems, they'd go, "We don't have enough support in
Mhm.
this department.
Yeah.
We need another technician. We need another whatever."
Right.
And that's just not what they're doing.
No.
Maybe, or I assume they're probably not.
Yeah.
Like, why not just assess where? So, okay, wait. We got kind of off on a tangent. She also asked, what can you do? I think last time we talked about this, it was going to the dean with solutions.
And you did.
So,
And it didn't work.
well, what was the solution?
Well, no, it wasn't a
I don't think
solution.
it
It
was
was
a
just
solution.
it was asking them
Well, they
how
brought
they
up the
felt about it.
conversation.
Yeah.
Yes, but we know how bad people are at crucial conversations.
Right.
But would you feel like that was an open door, open arms to go then have a more serious conversation on the topic if you got that response?
No, I
wouldn't.
don't.
As a student, I'd be like, well, the
no,
heck?
but my guess is that when you go and have the conversation, it's not happening in such a way that it opens up dialogue for discussion. So if you go in as a student and say, and maybe this happened, I don't know, but hey, I'm concerned, and I know your top priority is, so you would form what we call mutual purpose.
Mm-hmm.
So I know that we both, the student body and the administration staff, all care about how students are being treated, their morale, making sure that they don't get burnt out. And so I know that's of equal importance to both of us.
Mm-hmm.
And so what I'd like to do is sit down and have a conversation about how we can bridge that gap. Because right now we have a lot of students who are feeling like they're just cogs in a wheel, and that they're
Used and abused.
and that their mental health doesn't matter, and so here's what I'm proposing. Bleh.
I don't know.
What if we take a survey at
Maybe
the
they
end?
don't care.
Well, then, I mean, I don't think that's the case. I just don't think that would happen.
Yeah. I don't know. I'm just
I
saying.
mean, because
I have no opinion. I've never been through it. So.
because the clinicians are mad because they don't have any control over the situation. You're going to the wrong person to fix the problem. So, like, meaning the clinician, like in the news, they're just like, great, I'm just getting dumped on too. They're feeling the
Right.
same way the student's feeling.
right.
Like, this isn't my problem to solve. I'm trying not to make it worse, but I don't have any control over it. They're also putting these requirements on me. Like, so the student and the clinician are not like that.
Right.
You need to find somebody who can help you solve the problem.
Yeah, but I'm just thinking that that's response of the
There has
dean.
to be a
That-
dean of students.
Like a separate dean? Like
Of
the dean
students.
of the school and dean of the students.
Yeah.
For the people.
For the people. No, I'm just saying, like, it may not be, you're not talking to the right person.
Yeah.
Why not suggest taking the surveys at the end of
'Cause it
every
creates more work.
rotation? Because it's more work to
It
do.
creates more work for people. That's why they don't do it.
Okay, but
They don't have time. They don't have time.
Okay.
I think we should probably move on to the next one.
I'm just coming from the devil's advocate
I
side.
agree. I don't think that, I mean, I know it's hard. Oh my gosh, it's hard. Of course it's hard.
Yeah.
I mean, medicine is hard. There's no way around it. We can't make
Life
it
is
comfortable.
hard.
We can't make it comfortable.
Yeah.
That's my thing. At the risk of sounding geriatric, we cannot make it comfortable for everyone. I don't
You're not,
understand.
you're not wrong.
I don't understand how. Now, I'm not talking about abuse. That's different.
Mm-hmm. Right.
You're going to be uncomfortable. It is medicine. You're going to be at work late. You're going to have to go into work early. You're going to miss lunch.
Yeah.
It's all going to happen. Should it happen 100% of the time? No. Find a different place to work. Find a different place to go to school.
right.
But at the same time, it's going to happen. My phone agrees with me. That's all I'm saying is like
there is a balance between being a pansy and not wanting to work hard, but then there's a balance of the over whatever this we want to call this is. We don't want to use the word abuse, then we use
no. I think abuse in some situations probably happening. Now the human medicine has done this. Like it used to be that they did not have restrictions on the amount of time, and what they saw was the error rate went up in these residents, and so they changed that.
Right
now they have rules like you cannot work this many shifts, blah blah blah.
Right.
So maybe they just need something like that. But again, it's just going to require some students are going to have to carry the load to change the problem.
Right. Because they're trying to change the wheel at that point of something that's pretty much been doing the same thing for a very long time. But I mean, they're kind of changing it, or they're not. The system is by going out to the clinic or the hospitals now for 4th year. So that would
that leads us to our one question.
That would be super interesting.
Not yet.
Hear.
It's not yet. Okay.
If that makes a difference, I would be super interested.
I don't want to see students. Let me just be clear so that I don't get yelled at. I do not want to see students abused, but I also
Dr. King doesn't support students.
I don't want to see students coddled so much that they cannot handle reality.
You'll get punched in the face with the real world.
In the real world.
Right. I agree. I think.
And the load of what's happening in school. I'm thinking of the coddling
and how that would look. And I feel like that would.
The load that's happening in school needs to happen in a supportive environment.
Yes.
In my opinion. Just
to prepare you.
Just like my kids, when I'm raising my kids, I want them to be challenged when they are with me so that they can navigate the issues while they're with me, so that when they're on their own, they have better. Now, that's probably not happening. That's why maybe the anxiety and all the other stuff is happening out in the world once they get out.
Yeah.
So we need to create better support systems for them in the school.
Agreed.
Okay, we're not going to fix that tonight.
Okay.
All right.
Are you sure?
I'll stop talking about it. Okay.
Wow. Okay, next one. For issues like anxiety and reactivity, what's better, SSRI or situational sedatives? From @A_Stolak.
Well, that's two different things. Anxiety and reactivity are
situational anxiety. I think she's talking about situational sedatives, like situational.
Right. Yeah. No, I understand. Like you got your I don't know. I guess I'm looking at the anxiety as like, are you talking about generalized anxiety, like a dog that needs something all the time? Are you talking about storm anxiety?
Oh yeah.
That's how
situational anxiety versus
leash reactivity. These, I don't know. I guess it depends on how you define a lot of.
I would say a lot of times you're using both of them.
Yes. I think it depends on, again, the level of anxiety or whatever.
I would agree.
So
and what you're using it for.
Right. So I guess we can just do an example. A dog comes into the clinic that's not nice or hates nail trims. Typically, we'll pull for the trazodone, which is an SSRI, right? And then we'll sometimes combine it with ACE, promazine, if we need a higher sedative effect.
Gabapentin.
Or gabapentin.
Tilzol.
Methadone.
I guess, okay, here's my thing. This is how I usually separate it. If you've got your situational stuff where it's a one and done event, you can point the trigger. I'll reach for the short acting, like your trazodones, your ACE promazines, your gabapentin, but if you're talking about like an everyday, like this dog is high wired all the time, or it's a trigger you can't always control. So like people walking outside your window and whatever, then I'm looking for more of like your Prozac.
Long term.
Yes, long term.
Fluoxetine.
With training, of course, in all of this.
Yes.
That's how I separate it.
And then I would even use, so like if you have a dog on fluoxetine and then it comes in for whatever, like an exam, and it's nervous or anxious, then we'll use other drugs on top of that.
Right. Yeah.
Yep. So.
Yeah. I don't know. It just depends on the situation.
Depends on the situation.
Mm-hmm. You'll figure out which potion you like as well, because it depends on the dog and the dose, and you don't know until you try it.
Time frames.
Yep. Mm-hmm. The owner compliance.
Yes.
Okay.
What's your guys' opinion on all new vet schools opening in a few years?
Great.
At KK_.Phillips.
Great. Do it right. Be nice to the students.
Well, you brought up the point of they're going out into clinics.
Right.
With have normal or worse hours of operation.
Yeah, I don't know.
So, I mean, yeah.
We think it's great because apparently there's not enough vets. Sorry, I had to say it.
I think that I think they're going to serve a role just because, I mean,
we need more vets.
I guess so.
I just think it's another way for students to get in.
More opportunity for people.
More opportunities,
like
different teaching methodologies, so
Yeah.
people do better with this, versus a different one.
Great. Love it. Bring them on.
Yep.
Okay, number
Fill
5.
'em
up. Fill them up.
What are everyone's thoughts on holistic veterinary medicine? At JasmineHarris.1. Great question. I'm not against it.
I was
Me
going to
neither.
say I'm not against it. I don't have a whole lot of experience with this, so I feel like I can't talk on it too much, but I don't think it's horrible.
I think, again, it depends on the topic of like what you're looking at. Do I believe in holistic medicine for flea prevention? No. I don't think you're going to get very far. But I believe in like the
Pain management, maybe?
Like acupuncture.
Yeah, so I was
or-
just going to say
Mhm.
acupuncture I think is great. Like I don't know. I think that just depends on what other type of holistic stuff.
I would say other like medicinal things, like meaning
Hmm.
like supplements
different
and things
types
like
of
that.
supplements and stuff.
Like
yeah.
Union Bio, whatever we call
Yeah.
it, like for
Union
bleeding.
Bio.
Yeah.
Union Bio.
Yeah.
For bleeding.
We use
and things
Denomere
like
all the
that.
time.
Yeah. So
I
I think
have
there's
this-
definitely
I think it's fascinating. I have this one client and I really appreciate how she does it, but she's got an old geriatric Aussie, I think, and she does primarily holistic, but also comes to us for like the stuff where
Yeah.
either holistic medicine didn't work
Mhm.
or they couldn't figure out the issue or whatever. So it's like using the nice combo of both, and the dog's in great shape, great health, and it's
I love that
13.
integrated approach.
Yeah, I do too.
Yeah, because I don't think it's
She's very
one or the
open
other.
to our stuff. And
Right,
she'll
yeah.
tell us her limits on like, I don't want to deal with this with you guys, but I want to do
Yeah.
Yeah, she's awesome.
Yeah, I think it's
So-
intriguing. I think we
Mhm.
could do better at trying to use
And-
both
yeah.
of them.
Rather
Yeah.
than just shut it down.
Right.
When owners say the
Well,
word
and I think we
holistic.
just don't learn a lot about it.
Right,
I mean, it
true.
requires extra
agree.
CE to go learn about it. And I
Mhm.
do think typically in communities, you're going to have people that have done the CE, that do have knowledge
Right.
about the topic.
Yeah.
So for sure.
Okay, next one. How do I get animal experience as a minor when everyone considers you, due to age, a liability? At NII._.morphos. Morphus?
Yeah. I think
well,
there's
that's hard
definitely
to
places-
navigate, but we have help like high school students who
15
come in
and older.
Yeah, and they will help clean, but then eventually along the way we let them restrain, but we limit the restraint to patients that we know are not going to cause any kind of injury. So if it's like a really, really, really nice dog, that's when we'll teach them how to do restraints and things like that. So we limit what they can do, but we still allow them, they can still watch. They can watch anything they want. But then if they want to be hands-on, we just, as technicians or whoever, the more experienced, will make sure that there isn't a risk of injury.
Yeah, I think just getting your foot in the door at a clinic, if you're
Mhm.
wanting to work, and be paid,
Mm-hmm.
I mean, you could just clean, to your point, be a kennel attendant, those kinds of things.
Mhm.
And
Be
then
around,
as you
ask
show
questions.
responsibility and
You can still watch.
yeah,
Yeah.
If even if you can't touch a patient, it's
humane
still
societies
Oh, yeah.
dog
are
walker.
nice because
or
they're not
whatnot.
owned by anybody.
Sure.
So again, liability is less
Yeah.
because they're not client-owned animals.
Yep.
So any rescue, any humane society,
Mm-hmm.
Mm-hmm.
any shelters like that would be good
Yeah.
places to start as well.
Agreed. Okay.
And then tell your parents to just buy more animals.
Okay. That's right. Not to be a bad influence. But
Right,
just get more
exactly,
animals at home.
exactly.
Oh, you could go work at a pet store.
Oh, true.
A lot of pet stores, I mean, I don't know if I say I support it, but a lot of pet stores sell animals, so you can take care of those animals.
That's true. There you go.
Fish, puppy skins, gerbils. I started off in pet stores.
There you go. Okay.
Okay, sorry, next one.
Where are we at? 7. What are your thoughts on Librela and developing class action lawsuit? At Sierra.May0303.
Love Librela.
I can say, we know there's a lawsuit, I guess. We could say that. I mean,
We're still giving patients Librela.
yeah, I mean, I still believe in its efficacy and using
Mhm.
it for patients with osteoarthritis.
Yeah.
I have no issue using it.
I think every drug has a problem.
Yeah.
We're in a very
gonna come
litigious
across it.
society, so
Yeah.
I'm not surprised.
I know.
You could probably find a class action lawsuit on anything.
Yeah, right.
Mm-hmm. I don't use
But-
it in neurologic cases.
Right. Use it where it's supposed to be used.
Use it wisely.
Okay. No Kingling.
Are you coming to WSAVA in Brazil? No.
Yes.
I want to.
That would be legit.
Can you ship us there? We will go. We can ride. We will all ride in one box. We'll be like, what's the show? What's
Madagascar.
Thank you. Madagascar. We're all going to ride in a box, end up in the ocean, land on a beach, and then we'll make it to the symposium.
Do you want to finish that and then we can talk about it?
Okay. I'd like to meet everyone at Eli Angel
Torres.
Sure. Angela.
Oh, sure.
Eli Angela Torres?
Yeah.
Sure. Okay.
Thank
you so much.
We have no plans to go, but we will go.
We will go.
That's a
Send
great
us an
question.
invitation.
Yeah.
We will go.
I've never heard of it before.
Nope.
Okay.
Either.
We'll do our research.
It's world. I'm sure it's world student.
Oh.
Yeah.
Sure. That's pretty cool.
Okay, maybe you'll see us in Brazil.
Okay. Next one. Who's next?
If you see an animal that's abused, how do you discern if domestic violence is also occurring? @_Angela_Faith_. Yikes. That's a
really
loaded
hard.
question.
I have not, thankfully, been in this situation. I do not know.
Yeah, I mean, I think you would look for signs of domestic abuse in the exam room,
Yeah.
like between the two people
Right.
or between the person. I
Yeah.
mean, like I'm trying to think like when you're in a hospital. Okay, this sounds really dorky. Actually, I was thinking of a gas station.
What? What did you just say?
Gas station. Not a
Where do you
hospital,
go?
gas station.
When you go to a gas
She's
station.
creating a mental picture for us. Give her a minute.
You just went from hospital to gas station?
Yes, she's being honest.
Wait a minute.
I'm laughing so hard. Okay, I'm sorry because this is not a funny topic.
No,
I
that's
was just
okay.
thinking of myself and in a gas station, and you see the signs that say if you need help,
Yeah, call somebody.
but that's for traffic.
What are you talking about? So you're saying we should put those posters in the clinic?
I mean, we could.
No, I was thinking in the hospital they talk about like, do you feel safe in your own? Have you ever gone
every
for
time you go-
surgery?
Yes.
Well,
And then they ask you like, are you
every
on any
single
drugs?
with your
Any
partner.
single time you go to a doctor's, they have a whole checklist.
And
Are
they're
you
like,
safe
do you
at
feel
home?
safe
Are
in your
you-
own
Yes.
house? And I'm like, how do I answer this question?
Yes.
I live with all boys.
Right. Most days, yes. Sometimes, no. At night, no. In the day, yes. Like, how do you want me to answer this?
Yeah.
Anyway, I'm sorry. I'm not making light of the situation. I'm getting myself in trouble all over this episode. Okay. I think that you can tell when you're in an exam room if you look for signs of domestic abuse between two people, if they're both there.
Yeah, I mean, I think I would assume you would pick up on their
Dynamic.
vibe, their energy, their dynamic. I don't know.
Yeah.
So like if
Yeah. I don't know. Also, I mean, I guess it would maybe spark more questions if what's going on with the pet is more obvious of like
Yeah. If you get like weird stories that don't match, like,
Yeah.
Maybe there's a way to separate the people in the room.
Yeah.
Like, hey, will you help me take Fluffy to the back?
Yeah.
And you get a story from that person and somebody else is getting a story from the other person in the room. Like you might be able to
Yeah.
glean like some differences between the story or a vibe.
That's a crazy question.
But it is hard.
That's
I don't.
heavy.
Yeah, it's a heavy question. I suppose you would, if you were really suspicious of it, then you should call somebody.
Right.
I don't know. Yeah.
I agree. Yeah. I mean, you call authorities that have jurisdiction over that.
Yeah.
I just feel like it'd be so
Like
it's
you're not
heavy,
just
it's
going to sit there and
messy.
be like,
Right?
do you do that?
I
like,
know.
That's not, I feel like that's out of our
I don't know.
realm,
Yeah.
out of our professional
Yikes.
things.
Well, good question, but
I don't want to have to deal with it, but
I know.
oof.
I hope a lot of people don't have to.
Yeah.
Okay. Okay, number 10. How do you guys treat or get rid of idiopathic stress-induced cystitis in cats at the town vets?
Make the cat less stressed. I'm just kidding.
That's a hard disease, but usually you can tell by the personality of the cat or what the owner is saying, and you just pretty much, I go straight to talking about fluoxetine or, well, I shouldn't say I go straight to it.
You
I
work
talk
them
about,
up and
you
know
work
that
them
it's
up.
not. Yeah.
Yes.
It's
And then
it's a rule out.
I
It's a
try
diagnosis of rule out.
I try to say let's try like the over the counter feel away, the like the composure supplements or treats and stuff like that.
Try to reduce triggers as much as possible
Exactly.
or stressors in the cat's life.
Yeah.
If possible.
Try to figure out the stressor. I mean,
Yeah.
maybe it doesn't like the other cat in the house, or I don't know. But then usually that's not enough, the over-the-counter.
Yeah.
So you just talk about fluoxetine or amitriptyline.
Cats are very sensitive.
Yeah.
Diet, there's
Diet.
CD and Stret plus stress, or SO plus like the multi-care.
The multi-care ones are
with
really
stress.
good. The polygags, like Adequine, we've used.
Yes.
They think that there's, in the cats that get cystitis, don't they think there's something wrong with a lining on the bladder wall that makes it less likely to be able to heal or fight off?
Oh,
It's called something. Why can't I think of the name of it?
I don't know.
Like the condition?
No, what's missing?
Oh.
They have lower levels of
Like an
something.
enzyme, like a receptor.
I can't remember
Like a
now.
nerve.
Brain fart.
Okay.
Taurine.
But so people, I know.
Just kidding.
But people use Adequine a lot of
Huh.
times to help because it's
Oh.
polygag. Anyway, that's
Yeah.
another treatment.
Fascinating. I haven't done that one yet. I'll have
So-
to try it.
We said drugs, diet, reduce stress,
Mm-hmm. Environment,
whatever, and then
enrichment,
enrichment.
which is
So-
environment.
that's actually, you bring up a
Make
really
the
good point
cat
because
happy.
there's another bunch of studies that show like they need perching areas.
Mm.
Like there's like the cats that have more issues with stress-induced cystitis don't have perch areas. in
Like
their
they don't have a
houses.
place to get away.
Yeah, they
Oh,
don't because they want to be
I've
elevated.
heard that. Yeah.
Yeah.
Anytime they're out of the window watching birds, Charles and I go, enrichment.
Enrichment. That's
it's
right.
helping
exactly.
their brains.
Yep. Yeah.
Okay.
I don't know if I've ever treated an indoor-outdoor cat for cystitis. Inflammatory stress-induced cystitis. Ever. I don't think I ever have.
I feel like I definitely. Mm,
Just thinking
I don't
about
know.
that.
I'd have
It's
to
just
think through
interesting.
it. I don't know.
Anyway.
I can't think of one.
Yeah, I don't know. I'd have to think through it.
Okay.
11?
Oh, what is everyone's thoughts on Zenrelia?
That's a great question.
At sauce.
So.
Godal. God all. So God all.
got all.
Sure.
Okay.
These are the most
Mm.
interesting usernames I've ever heard.
I haven't used Zenrelia.
I haven't
haven't
used
either.
it. I have a patient that I came to be a new client on it already from the dermatologist.
Okay. Well, I know
Um,
dermatologists are using it. I think even more than GPs
Yes.
right now.
Yes, I know that
Because
there's
they're like the wit's end. Like,
Yeah.
I need to do something.
legitimately
Yeah.
there are some cases where they're like, hey, we have to try. And the new client that had got put on it was told about the warning on the whatever. And they were very like, okay, yeah, we understand. We'll just use something between
Yeah.
to follow those guidelines and rules. But they said it was like life-changing for their dog. So I think, at least from talking to other doctors in our practice, we're not against using it or trying it. But I think at least right now with the comfort level, especially with that black box warning and the concern of, honestly, owner compliance and what goes along with that black box warning, I think it's more of a like when you're at your wit's end option.
Yeah.
Last ditch
Or honestly, if I get to that point and depending on the situation with the client and all of that, I'll send them to the dermatologist to have,
And
them,
have them
start
start it.
yeah.
Yeah. Exactly.
So we're not like
I don't blame
against
you.
it. We're not keeping
Yeah.
it a secret, but it's still really new. So
Yeah. And I think they're always when the specialists start using it and you see how they're using it.
yes.
And you see, like what they're doing with it. I think that buys a lot of comfort.
Yes.
Like in terms of us using it that way.
Yeah.
Or being able to use it or feel more comfortable using it.
Yeah. And what the clients say about it too.
Yeah.
Okay. Last one. I want to know how many vets are unhappy about the path this profession has taken. For instance, if it's not gold standard care, my clinic can't do it. I had a very poor client who presented a dog with a very badly broken front leg. The owner had no money. We casted the leg and said it can only be like this for so long since it needs to be pinned with external fixation, which is $10,000 or more where I live.
Wow.
I suggested that we amputate the dog's leg and was given the answer that's not gold standard care here. We cannot do that. I still believe that procedure would cost nothing in comparison and they would still have their dog. Doesn't that seem against the do no harm mantra? What would you do? From Sandra Peart.
Well, I'm old, so you know what I'm going to say, Sandra.
Get rid of that leg.
Cut that leg!
Cut
Chop it
that leg
off.
off, baby.
I completely agree.
I mean, this is absolutely ridiculous. This is one of the things that we've talked about
Yes.
historically on the podcast. I think it was even on the Dean of Colorado, like her episode, we were talking about care and I don't know, like, people
not
are
thinking outside
or
the
maybe
box.
it was Dr. McCormick.
I don't remember which
one it was. Anyway.
Yeah.
Like,
It's
what are
sad.
we doing? That's
It is
horrible.
disheartening.
Take care of the dog. Take care of the animal.
Yes, I agree. I feel like it's against the do no harm
I
mantra.
agree completely.
I agree because they're stuck with what? $10,000 or euthanasia.
Like, would you rather be in a bag or have 3 legs?
Right.
I mean, like that's
The
what
amputation is
the
that's,
dog does
that's
not care.
harmful. It's not like a surgery that would be against medicine. Like
Right.
I just
Yes.
it's frustrating. I'm frustrated reading that question.
Well, the fact
Like,
that they
I
just
would
said
be
no at all,
frustrated.
like they're not willing to try something else to help the owner in order to keep their dog.
Right. There has
That's
to be a scope of
insane.
care. Like,
Yeah.
sure, offer the gold standard.
Well,
Like,
of course.
absolutely. And then when they say there's just no way we can do that, then you're like, all right, here's our next best Here's our next
Right,
best
exactly.
option. Our job as a veterinarian, I think, is to keep the animal with the patient, with the person, as long as possible.
100%.
Yes.
So, like,
Help solve the problem with doing no harm, of
Right.
course. There's a line to be drawn there, but
You're doing more harm by letting the dog go home.
it's a
and be in
disservice.
pain
You're
and
disservicing that dog
Yeah.
and that client.
I would
Yes.
agree.
I hope that you under the table said, go to this place and get your dog's leg amputated or something. Like,
Yeah.
save your dog.
Yeah. I'm assuming maybe she's a veterinarian, maybe she's not. I don't know. Does
I
it say
don't-
anywhere in here
No, it
No.
doesn't.
about the path this profession is taking? I would say that you need to stand up for
Mm-hmm.
that
You have
inside
to be.
the clinic.
You have to be also your patient's advocate. That's what we are there for.
Yeah,
That
and
is
I
our
think that
our job. as
Again, if
well.
you can explain and this would go back to the core values of this clinic.
Uh-huh.
Right.
What are the core values of the clinic? And if amputating the leg fits into the core values, then you should do it.
Yes.
Right. So your argument back to management would be our core values are this, this, and this. This amputating the leg and keeping the patient with the family for as long as possible is one of our core principles.
Yes.
That is why we should do it. I understand it's not gold standard care. I understand they know that. Like, all of those boxes are checked. But this is why we should make this decision. If your clinic does not have core values, that's where the problem lies.
Mm-hmm.
Mhm.
Like, you need to figure out what the core values are, and then so that all the decision making can go back to that, and then it's
Yep.
easy peasy.
Yep.
Yeah. Otherwise, I'd go find someplace else to work. Yeah.
the house core
They don't
values you
deserve
agree
you.
with.
Yeah, they don't
Yeah,
deserve you.
that's crazy.
Okay, great
Okay.
question.
Wow. We shouldn't have ended on that one. That was hot.
I mean, we were passionate about it. Take
We're
that
passionate
dog
about
sleeve
it.
off.
We're just like, take it off.
We're very
We have
passionate about
reached
most of
our
these
threshold
questions.
for
That's right.
today. On that note, thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
All right. Thank you. Woo woo.